Hey everyone, I'm glad that you're all here. My name is Dr. Josh and we're going to hang tight for just 1 second. I want to let the clock strike 8 o'clock so we can get the live stream going. Though this is recorded, you'll be able to watch it again if I talk too fast. So I'm just going to give it a couple more seconds and here we go. All right, everyone, welcome to How Do We Help Bulging, Herniated, or Degenerative Discs without the use of drugs or surgery. We want to help people with their disc injuries one disc at a time. So we're going to start off here. Who am I? Who we are? And I think you'll really enjoy this. So we're what's called Disc Centers of America. We're also a certified 100-year lifestyle chiropractic practice. So what that means to all of our patients is we can help get you from a crisis, from a disc problem, all the way to a healthy lifestyle or wellness, which some people call. So we've been around for a long time, over 65 plus years of experience between myself and my father. We're part of a nationwide group that has over 250 offices focused on utilizing non-surgical approaches to address spinal problems. That's really, really great. We've invested so much time, energy, and resources for the practice for you, for all of our patients and future patients. We've done a lot of clinical training. We have very specialized high-end equipment. We focus on patient outcomes, and the word doctor doesn't only mean to teach and tell people what's going on with their health. It also means become a detective and help a patient get the results they're looking for. And we align with all top doctors in the field, the researchers, the ones that are actually doing and creating the national certifications for non-surgical spinal decompression. So what this conversation, what this webinar will cover today, let's just do a little review so you have an idea of the direction we're going to go in. I'm not going to keep you here a long time, I promise. My job is not to talk all night because I definitely can do that. So if my team is watching, they know I like to talk. So I'm going to do my best to keep it simple, to keep it precise, and not too much fluff in here, if you will. I love the talk. So we're going to talk about stats on back pain, stats on disc conditions, symptoms, what you could think of about having a disc condition, common causes of disc problems, common treatments for disc conditions, what we do that's very different and makes a difference, and then, of course, resources that make you resourceful. And I apologize if you hear a bark or something like that. I have my co-partner here, Gunner, my dog. So he's quiet. He's pretty good most of the time, but he may be a little vocal for a minute or two. So hopefully not. So let's look at some back pain stats. These are quite staggering. This back pain affects over 30 million Americans at any given time. They say 8 out of 10 Americans will be affected in their lifetime with lower back pain or back pain in general. It's more common overall in women than men. 54% reported it's all from desk work. That's kind of crazy if you think about it, more than half. And 9 out of 10 patients never know the primary cause. It's quite staggering, these stats, because we look at this. Most people are thinking, what type of injury did I have? Where did yours come from? There's a high likelihood, if I were to flip a coin, 5.4 times, so more than 50% have it from just sitting at a desk and working. Realize you sat at a desk from the time you were a child all the way through your adulthood. We have patients that are utilizing our services for disc injuries that are in their 20s, and we have people in their 70s and 80s as well. So I don't want you to think this is only an age thing, but there are some age statistics, if you will. So 80% of patients 60 years and older will have some form of DDD. That stands for degenerative disc disease. It's not really disease. Degeneration is degeneration, right? It can happen in one segment. It can happen in tons of segments. I don't like the disease word when it comes to it. 10% of patients with disc conditions will get surgery. That's a huge amount. That means 3 million, right? If 30 million at any given time. It can take several months to heal. 2 to 1 when it comes to these disc conditions are men to women. And 90% of disc bulges occur in the low back. So in our practice, we treat both the lower back disc injury as well as the neck disc injury. And we're about 50-50, even though the nationwide stats talk about lower back being the primary. So disc conditions are the different types of disc conditions and the things that show up from having a disc problem. Many have heard of a bulging or herniated disc. Sciatica, if you've had sciatica, you know about it. You've Googled it, you've looked it up. That's that pain that starts in the low back, radiates through the buttocks, goes through the back of the legs all the way down to the feet. This can be awful and debilitating. Some people have it on and off. Some people have it all the time. Degenerative disc disease, like we said, that's the breakdown, the arthritic change that can happen in a specific joint or multiple joints, where we have the space of the disc that starts to shrink and it actually starts impacting the shape and the function of the joint and the bone. Peripheral neuropathy, this is where we're now having this disc problem impact the nerve. And peripheral neuropathy, peripheral means away from the main frame of the body, so arms and legs and feet, right? So most common is the lower extremity of the feet. And what happens, the nerves get weak, the blood flow diminishes to those areas, and now we start to have this numbness, this almost like I'm walking on clouds or maybe even walking on thumbtacks type of sensation. And it's usually pretty awful. Sometimes you don't feel anything and it's so painful because it's so numb. Facet syndrome is very similar to sciatica. Facet syndrome is when you have that lower back pain that rolls down to just above the knees. Doesn't go past that back down the back of the legs. It stops at the knees. Again, extremely painful. Pinched nerves can look like many different things. You can have them in many different areas in your spine. You know, if it's in your neck, it can create radiating pain that goes down through your shoulder all the way down to your fingertips. If you have it in your low back, you know, a variation of that could be sciatica, or in the front, we could have the anterior, the front part of the legs going numb as well. Weakness, you could have this in the arms and legs. Oftentimes people have balance problems. And one thing that will show up when we have these disc injuries, because the brain is now talking through the spinal cord throughout 31 pairs of nerves, and those nerves have to pass in between two bones where the disc is. So when we start to change the shape, if you can see my picture, I know it's probably small on your screen, but we change the shape of that disc, we will start to eventually change the shape of that opening where the nerve exits. And that enables function in the lower extremities as well as digestion and other things from the low back. But now we start to impact the neurology that goes to the legs, and you may feel unstable on your feet. You may feel uneven on your feet. You may feel a little wobbly, and that's very common. And you know, there's the infamous chronic or intermittent back pain where many of us may go, you know what, I'll wait for it to go away. Some of the most dangerous words in health. I'll wait for it to go away. Well, it usually goes away in a day or two. It usually goes away in a week or two. If this keeps happening over and over, you need to look a little bit deeper into what's going on. So typical symptoms, I mentioned a few of them before. There's all the different types of pain, which some are noted below, but we have aching, burning, stabbing, weakness, tingling, the electrical shock, if you will, cramping. We get a lot of muscle cramping, numbness, and sometimes we mention that balance issue, like that sensation that can happen in the bottom of the feet, like almost like you're walking on thumbtacks. So these are all different types of symptoms that show up, and we've seen all of them. They've all walked or been being walked into our practice with another patient or a friend or family member helping them. So as you mentioned, or as I mentioned before, we have, you know, the common causes of the disc problems, the pathology, and that bottom picture, I found this very simple picture, but we start to create this awful posture while we're sitting, and we've all sat for so many years of our lives that's the most common way people injure their spines. But yes, there are automotive accidents, there are workspace injuries. We have that weekend warrior syndrome where you may show up at the gym once or twice a week, usually back to back on a weekend. You do way too much, then we end up hurting ourselves. The posture, again, is mentioned. Improper bending. So this doesn't mean just lifting weights. This can mean picking up groceries. This can mean moving something in your house or your apartment. And all too often we have the I don't know where it came from, the unknown. And this is the scary one, because when we have patients come in and then we ultimately refer them out to get an MRI after we have proper imaging done, they have, you know, 1, 2, 3, 4 herniated or bulging discs, and they go, but I didn't have an injury, right? There's that unknown. There's the sitting. There's the improper bending for, years of life that finally have caught up with you. And the most common treatments for any kind of disc pathology, the most common is physical therapy. The next step is usually opioids or pain pills. The next is epidurals, which are a steroid injection into the spine. And then last is surgery, which is the most invasive. And none of these will address the root cause of the problem. This is scary because ultimately they're just treating symptoms. When ultimately you want to get in there and help the body as much as you can, you would rather heal and heal the best you can than just mask the symptoms, in that order. The physical therapy, opioids, epidurals will ultimately lead to surgery if we keep going down the path we're going. So something that most people don't know, and I imagine many doctors don't even know, epidural injections are not FDA cleared for pain, right? For the low back pain. And this is just the article on it, and they're giving out like candy. What they do, they degrade the joint, they break down the joint, they actually start to break down the cartilage in that joint itself. So when we have an x-ray of someone that's had multiple epidurals, oftentimes their arthritis is pretty bad in that region, and often a lot of regions as well. So just be cautious. I'm not necessarily your doctor. I may not know you if you're watching this, but I would say details matter. All right, that's a resource. FBSS, failed back surgery syndrome. This is all too common. We have patients that they come in with this. If you've had hardware, it's harder to help that specific reason because they've literally bolted things together with screws that are inches long and metal rods that hold things still. Sometimes, not many times, sometimes they are necessary, right? Major trauma, potential paralyzation, things like that, of course, I understand. But the crazy number is this: 74.6% of low back spinal surgeries fail. That's huge. That's 3/4. And that's why you'll often hear that people will get sometimes 2, 3, 4, and 5 spinal surgeries, right? That's a lot. That's quite a bit, right? And they're saying anywhere from those failed back surgeries, they're showing statistics, and these numbers sometimes don't make sense in my head when I say them this way, but 10 to 40% of failed back surgery syndromes are affected from 80% of 80,000 people. We got 10 to 40% of those are impacted. It's really bananas. So I really urge you to be cautious. Do everything you can ahead of spinal surgery. I just heard this at a conference very recently. They're changing the names of this syndrome, possibly to confuse you. They're taking something called failed back surgery syndrome, which ultimately means the surgery failed. And that makes sense to most people, right? Oh, I got a surgery. They're supposed to relieve my pain, fix my problem. I still have pain. Clearly, it didn't fix my problem. They're now changing this to type 2 persistent spinal pain syndrome. So it takes all of the responsibility away from the surgery itself, which we know is problematic. It almost is hiding surgery is the problem. It's just, okay, I have PSPS, persistent spinal pain syndrome. To me, that's just wrong. But ultimately, surgery can be potentially for some people great, but most people, it's not great. Like you heard, 1 in 50 that have back surgery, they die within 3 years of that surgery. And you know what? The death rates are significantly higher when analgesics are involved. And the mortality rate increases 7-fold when caged devices are used in conjunction with analgesics. Remember that picture I just showed where you had the hardware put in, the rates go up 7-fold. Do the math. That's a lot of people, unfortunately. All right. And then after showing you all this bad news, you got to be wondering, well, Dr. Josh, what do you do that's so different? What's so effective, and why are you doing a webinar about this? Well, we do things tremendously different. We do something called non-surgical spinal decompression, which is an FDA cleared and backed research, and it is endorsed from the most published MD, PhD neurosurgeon in the field from Harvard. So someone with a lot of credibility. Okay. So what is non-surgical spinal decompression? We use laser therapy. So I'm just gonna move my picture onto the other side here so we can all see this. We have computer-guided motorized decompression. What decompression does, I want you all to picture, we've all eventually at some point in our life had used a plunger in a toilet bowl. Okay. If you haven't, okay, I'm going to explain this. So the plunger is to remove a clog. And negative pressure is not from pushing the plunger down, but it's from pulling up. And what decompression does is it creates negative pressure in that disc, which allows the disc to get back to its normalized position. Does it happen very fast? No, this is something that's methodical and does take time and repetition. As does everything good in life, time and repetition make magic happen in most people's lives and everything, whether it's learning a sport, learning a musical instrument, and helping disc injuries. All right. Our table is called the Hill DT. You can see it in the picture there. This was a video, but unfortunately, I'm unable to play the video through the software that I'm using. But what it does, it creates this wave, right? If you can see my hands, it creates this wave, which creates that negative pressure from the pulling open and closing and opening, allowing those discs to restore their hydration, restore the fluid, and they restore some more normal function. So the non-surgical spinal decompression reduces stress, reduces that irritation on those nerves. It reduces the disc pathology symptoms. So you will have pain reduction. You will have radiation reduction. ADL stands for activities of daily living. So we have patients that have been scheduled for surgeries that, couldn't move their head, a centimeter left or right. And now they're functioning completely normal, taking their family camping on the weekends. So pretty amazing. But activities of daily living are things like simple things: tying your shoes, brushing your teeth, walking your dog, walking yourself, getting up from a chair, groceries, all these things. And last but not least, I love that it increases smiles. When people start feeling better and healing better, you become happier, because most of these people that have come in for disc decompression, unless it's more recent injury, have had a chronic problem for such a period of time, and it's very, very unpleasant. We combine this with something called Class 3B cold laser therapy. This is not something, from an Austin Powers movie with laser beams, doing things. This is an FDA cleared device, and what it does is it reduces inflammation. It acts like a magnet for blood. I want you to think this. So it brings blood to the area, so it allows for healing to happen faster, excuse me. It reduces pain, and it actually increases your healing capacity. Just today, I used it on someone's shoulder. I used it on someone's knee. Every single patient that has come in from decompression, we use it on their spine, on those disc areas. So the results are quite phenomenal. And people feel sometimes results instantaneously. Some people it takes a little bit, but the results we're getting with these combined together, it's a secret sauce that only helps you heal faster and actually get a result from the root cause, not just painting, over the symptoms to make you feel good. Because that's something I won't do in the practice, because it's not, for me, it's definitely not something that's very ethical. So the non-surgical decompression, the cold laser therapy, these are what the devices look like. That's a real picture. The other one was a cartoon image, if you will. But you can see this woman in this picture is laying on the table. She's got a pillow under her head. She's got a couple different straps that are going around her waist and her pelvis. You can see that pelvic piece tilted up a little bit, her knees on a stool. And what happens, the upper portion of the body is held firm in place, and the lower body is pulled, and it goes through that wave, that negative pressure movement all the time, right? For usually 20 minutes in a session in our practice. And then we follow it up with that picture. That's the cold laser on the right. The two little, I call them little tennis rackets or the paddles. Those go on the affected area, and they're plugged into the main module there, the smart laser module, and we set the time up for you, and we get it rocking and rolling. And both of these devices, are FDA cleared, and they get results, which I absolutely love. It's even helping my father. It's helping me when I can get on there. I've had, I'll tell you my story another day, but I did have some pretty nasty disc herniations and bulges in my spine post a car accident, being hit head on by a drunk driver. So this has been a godsend in our practice for me as well. So let's look at some research, and we're gonna wind down with some research and what you can do to see if this is actually for you. So the Shealy study. This is Dr. Norman Shealy. This is the gentleman that I mentioned. This is a Harvard MD PhD. This research shows, we'll call it short term, so 1 year after their last session. So if you didn't even want to retain the changes you've made and keep being proactive, if you do a dead stop, you potentially have the ability to have 76% decrease in pain, right? Very different than the 74% of surgeries that fail. 76% decrease in pain even 1 year after their last therapy session when other therapies have failed. All right, this is just a little picture of the study. It's a retrospective clinical pilot study, so there's a lot of study going on in here, a lot of information, and we can get this information to anybody that may want it. There's the Odell study. This is really, really awesome. This talks about long-term effectiveness. You feel better even after 4 years post-treatment. 4 years. Many studies don't go very far for anything in healthcare. This is a 4-year retrospective study, which is quite amazing. This Odell study, you can look through it, read through it. It's really neat because when we have patients that are going to be doing this, whether they're, if they're young in life, you're adding a lot of life, right? A lot of opportunity to feel better, to function better, to have a life. If you're older, we want to have those last years of your life, if you will, we want them to be filled with joy, filled with feeling good, not constantly chasing a problem. So this really shows a lot of promise for people. And this is the Leslie study of the Mayo Clinic, and it shows with non-surgical spinal decompression, 88.9% effective for neck and back pain. Is it 100%? No. If anybody says anything's 100%, that's a lie. But I'll tell you what, if you're a gambler, which I'm not, almost 90% here is pretty good, right? It's pretty darn good. So oftentimes we get questions, at this point in the conversation, well, this all sounds good. Does my insurance cover it? If not, how much is it? So here's some answers. So no, it's not covered by insurance. The reason why is they consider it to be elective. Similar to certain surgeries, they're elective surgeries. For instance, I had LASIK eye surgery. That was elective. That was for better function. Insurance doesn't really care too much about better function. They're really concerned about just covering symptoms up. They will pay for those things, but they don't not into getting to the root cause. The cost can range. The national range is between 200 and 300 plus per treatment. I've seen high as 450 treatment. We're not in that high range. We're somewhere in the middle. And if you're going to come in and have this conversation with us, we go over all of this in detail with you. And we have lots of really neat savings because the insurance companies don't cover this. We are flexible with our payment plans, and we actually get people well. So it's really, really neat. So we'll go over that when you're in office. So I had to determine, I apologize, some of my images here were lost in translation, when I transferred this to the webinar form here. There was some cool artwork on here. So how do we determine if you're a good candidate? One, we have you come in. We perform a detailed patient history. Many times patients will go, wow, this is a lot of stuff I'm filling out. And the answer is yes. Details matter. Your health matters. Like I said earlier, being a detective is step one, getting results is step two. But if you don't let us become a detective for your health and your spine, it's hard to get results. So we do that detailed patient history, then we sit down, have that consult and conversation. We do an examination specific to those disc injuries. We do proper imaging. And what we do in-house in our practice, we do digital x-rays. And the digital x-rays will let us see what the structure looks like with weight on it. So AKA what that means is we're standing, we're not lying down when we take spinal pictures. So we want to see the effects of gravity on that. And when we have two bones, which you only can see bone on an x-ray, it lets us see the spacing. If the spacing is diminished and we have lined up examination orthopedic tests that are showing you have signs of disc injury and the history also shows the same, Then we refer to get you an MRI, which is the gold standard, the absolute gold standard in knowing if you have a disc injury, but it's also the gold standard to give you the proper prescription for care in the practice. And what I mean by that, if you have one disc, two disc issues, five disc problems, if they've been there for a long time, if they've been there for a short time, how severe are they? All those things matter. And it's not a cookie cutter where, everybody comes in and gets, 400 treatments. You're going to get what the research shows you should get, right? Because we want you to get the best result. If you don't get good results, it's on us. I want to make sure you have the best opportunity to get the best results. So that's where that prescribed care comes in. And that's why we always say patient success always starts on day one. And I'm going to do one better. It starts before day one. It's the education like this before you even walk in the door, so you have an idea of what to expect. So next steps. What do we have? What do we need to do? What should we do? So this is where we get to close things down. I want to finish up the webinar, and I want to thank you all for being here and taking the time to show up live, or you're going to be watching this recorded. We're going to be doing more of these as well. I want to share the next steps with you. And the good news, since it's recorded, this will be, on YouTube saved and other places as well. So first things first, let's thank you. Like I said, we ultimately need, this is not for everybody. And I don't want you to think this is for everybody. We want to find out if you're a candidate. If you had any of those signs or those symptoms, or maybe you even have an MRI that shows a disc bulge or herniation that's less than a year old, this is what we want to know. You can find out how we can get you that health pass, which you can see on the right side of your screen there. We normally do a $400 initial visit, and I still think that's a very good price. We do this, if you found us on this webinar, we do this for $49. You gotta either take a screenshot of this. I'll move my face again one more time. You gotta take a screenshot of this or mention the webinar online, and we'll accept that $49 for the consultation, the examination, x-rays if indicated, the review of the findings to see if you're actually a candidate, right? Really, really, really important. So I want to, if you have imaging, please bring it in. And if you're still unsure, we can have a 15-minute phone consultation with one of the two docs in the practice, myself or my father, Dr. Jahant, to see if you should come in and take advantage of the $49 health pass. And what this will do, this will get you on a trajectory to actually not just feel better, but to heal better, to not just feel good, to be good. And you want more information, I know there's a lot we just went over in the last almost 30 minutes. Please go to our website, disccenternyc.com. You can see it on the bottom right side on the bottom of the health pass there, if you can see it. And our phone number there is there as well. So please connect with us. We want to help you. If you have any questions, our team's here. I'm here. You can, leaving comments on YouTube. Sometimes they get answered, sometimes they don't. So I ultimately recommend you call or text the number there, that 212-580-3350. And let's see if we can get you some help, the help you desperately need. So once again, I'm Dr. Josh, and I want to thank you guys for taking time to be here. And I look forward to helping you not only just feel well, like we said, get well and live a long, healthy life so you don't miss out on any of it. I'll talk to you soon. Bye-bye.